Donald Trump has been diagnosed with something called chronic venous insufficiency. The White House said it was a common diagnosis found in people who are middle-aged or older. Dr. Christopher Labos is a cardiologist. Hi, Chris.
Hi, Ms.
So, Chris, from what we understand, this happens when the veins weaken as we age?
Yeah, that's pretty much exactly it. So what happens is all of our veins have these tiny little valves in them that open and close, and they prevent the backflow of blood. So veins normally carry blood from the periphery towards the heart, and the valves are there to prevent the blood from flowing backwards. But what happens is that as we get older, as you said, the veins sort of weaken, the valves don't close properly anymore, and you can get a backflow of blood which goes down, and because of gravity, that tends to bring the blood down to the feet. And this happens as we get older, it happens as we gain weight, it happens in people who are standing for long periods of time. So all of those things play into it, but age is one of the main risk factors that drives it.
Now, Donald Trump is said to have been tested for this because he had swelling in his legs. So I take it that's a fairly common symptom?
It really is, yeah. So because of gravity, when your blood is pooling, it tends to pool in your feet, and that's why it's worse in people who are standing all day. It's not the only symptom, but it tends to be the first one. And we all have some degree of swelling in our feet if we stand for long periods of time. It is to some degree a little bit of venous insufficiency. It's just that it tends to get worse as we get older.
So how serious a condition is this?
Well, there's obviously a spectrum of disease. They say about 1 in 3 adults has some form of venous insufficiency. So most cases are fairly mild. You might just have a little bit of leg swelling, but it can progress. It can get worse. I mean, there are people who have leg swelling that's so bad that they can't put their shoes on. They have leg swelling that's so bad that it limits their mobility. So there is a spectrum of disease here. And while it's not life-threatening, it can be very uncomfortable.
So how would it be treated?
Well, for most people, you just sort of elevate your legs. If you're defying gravity, then the blood will not pool into your legs. So just elevating your legs helps a lot. Compression stockings can also help. People who have this problem will often go to the pharmacy and get these special types of stockings that will essentially compress the leg and sort of push the blood back upwards so that your legs don't swell. They are very effective, but they are not easy to put on, and a lot of patients find them very uncomfortable. Apart from that, there's not much that you can do unless there's a very specific anatomic problem that you can go in and fix with surgery or an intervention, but you would only be doing that in a sort of very, very severe case.
And what happens if someone chooses to ignore this, if it's not treated? What are the possible complications then?
Well, the worst complication is that the leg swelling gets worse and worse, and then you start to get skin breakdown. So it can become very painful as the swelling starts to stretch the skin, and when the skin breaks down, you can actually start to get ulcers on your skin, and those are very difficult to treat because you basically have to treat the leg swelling, which can often be very difficult. So that's really the end stage complication, the thing that we really worry about. It's the skin breakdown and the leg ulcers, which can be very painful and very debilitating. And, again, while they may not kill you, they can really affect the quality of life that can make life very unpleasant for the people who have this.
So at what point then do we know that it's time to go see a doctor? Like, how bad should it be?
Well, if it's starting to bother you, then you should at least go and see a doctor, because here's the thing. Leg swelling can actually be caused by multiple different things. And in the press release that the White House put out, they actually rattled off all the things he doesn't have. So you can have leg swelling from heart failure, you can have leg swelling from kidney failure, you can have leg swelling because your liver is starting to fail. So those are the things you also want to exclude. You want to make sure that there's no blood clot present in your system. That's another possible complication. So those are the things you want to exclude, and that's where medical testing is going to be useful. And once you exclude all of those things, then you're left with the diagnosis of exclusion, which is chronic venous insufficiency.
Okay, thank you very much for this, Chris.
My pleasure. Take care.